So today's webinar is going to be on patient demographics. This is part 2 of 2. If you missed part 1 of patient demographics, the videos are available online. You can access them from our website, and you just need your email address and the password of training, all lowercase, and that again is available on our website. There's an online training link under the support tab. So for today's webinar, it was, again, patient demographics part 2. What we're going to talk about today are the tabs across the bottom of the patient's account, and then we'll go and talk about the file menus up at the top of the screen. So if at any point you have any questions, let us know, and we will do our best to answer them or follow up after the webinar from our support team. So the first tab we're going to look at today is the Insurance tab. Okay, the Insurance tab shows all of the patient's insurances, both active and inactive. And you can see here we have our primary, secondary, and tertiary. Everything with a red line through it is a deleted or inactive coverage. All right, so we're going to kind of start at the beginning of how to add an insurance. And we're going to right-click in anywhere in this window. It does not have to be in the white part. You can right-click anywhere, and we're going to go into Add Coverage. From here, we're going to go ahead and just choose our insurance, and it's going to take us into the patient coverage information screen. You can see the patient's name at the top of this window, and then just below that you can see the insurance name and address and the benefits phone number if it is entered. Just below that we have 3 tabs. The first one is Coverage. That's the first one we're going to talk about. And then we'll look at referral authorizations and the eligibility. With the Coverage tab, the first box is the relationship to the insured. By default, the system sets every patient to be self-insured. If it is not the patient who is the policyholder, you can change it to spouse or child or other, and then you have this insured button that's available. You can go out, search for the spouse or the parent, and select them as the insured. Okay, the insured does have to have an account in the system in order to be selected. Okay. Then we have our coverage information. The coverage information, the first box is our coverage type. Okay, with the insurances, just about every insurance needs to be set as commercial in order for your claims to be sent electronically the right way. The exceptions to that are straight Medicare, so true Medicare, railroad Medicare, and DMERC. Those are set to Medicare Part B. Everything else, regardless of what the plan is, needs to say commercial. The reason that changed when they changed the claims format from 4010 to 5010 last year, they also changed what coverage types are acceptable. Okay, so commercial for everything except the 3 true Medicare plans. Then we have our group ID. If you happen to have a group ID, you can go ahead and type it in. The same thing with the plan ID. Those are not required for the claim to be sent electronically. However, we do require that the insured ID be completed. Okay, this is alphanumeric, so you can type in letters if you needed to as well. This has to be entered in order for us to allow the claim out of the system. The 2 checkboxes just below that, we have signature on file and patient authorizes assignment of insurance benefits to provider. If those accidentally get unchecked, your claim will still go, but it will kick out down the road for not having authorization from your patient. Okay, so if those are just left checked, you're good. With your coverage period dates, these are optional. The begin date is the date that insurance was active, so maybe this was a new policy as of May 1st, and I don't have an end date because it is still active. I don't know how long I'm going to have that. You can have one without the other. The reason these are helpful to have is once we save this blue cross, we're saying it went into effect on May 1st. When we're posting charges, if I'm posting charges prior to May 1st, so I'm kind of behind and I'm posting a charge back in April, the system is going to look at this insurance and say, well, it wasn't active until May 1st, so we're not going to put that on the claim. Okay, so it is helpful when you're posting charges. It kind of guides the system to choose. The system guides you to be able to select the correct insurance. Okay. Up in the center, we have the plan classification. Is it a medical plan or an optical plan? If it is an optical, you can check the optical box, and that will pop up the optical benefits tab. Okay. Just really quick on the optical benefits, this is where you can go in and put the patient's optical benefits for, their frame, their lenses, and so on. We're not going to get into that too much. We'll wait till the optical sessions. But when this optical box is checked, it just kind of helps the optical side choose the correct insurance to bill. All right. Then we have our copay and our co-insurance amount. If you know what the patient's copay is, you can type it in. Same thing if they had a co-insurance, you could type that in. With co-insurance, you'd enter the patient's responsibility, and then it will update the coverage responsibility amount. With the copay and co-insurance, when these are entered, the system will prompt your staff to collect that copay once the charges are posted. Okay, it's just kind of a reminder that yes, they do have one, and you'll also be able to view it on this main screen back here in the copay column. Okay, and then we have the insurance card front and back. When you have a scanner, it has to have the Twain drivers downloaded. You can right-click and add from scanner. You can add from a file. You can tell it to scan just the front or the back. Okay. If it's a duplex scanner, you can check duplex scanner, and it will automatically scan both sides at once, putting the front of the card at the top, the back of the card in the bottom, and then, of course, you can save this to a file, print it, or clear these windows. When you double-click on this window, it does bring up an enlargement, so you can view those numbers more easily. Okay. All right, I'm going to go ahead and click OK on this, and now my insurance is listed here. Well, if I double-click on it, or I can right-click and edit, there's one other button in here. It's the history. Okay. The history button is like system audit for the insurances. It shows when the insurance was entered and who entered it, and then it shows all of the edits that were made. Okay, so this is where we enter the group ID, the plan ID, the insured ID. Okay, the effective date, self to spouse. I said Richard Smith is my policyholder, copay. Every change that was made on this insurance will be reflected in here. You cannot change or delete any information. It's a very good tool to go back and figure out what happened or who entered the insurance information. Okay, so that's the main information that's necessary for the insurance to be added and saved. The second tab is referral authorizations. Referral authorizations, if the coverage is set up, if this insurance plan is set up at the coverage plan level, so under file billing, billing setup, coverage plans, to require referral authorizations, then you'll see this tab. Otherwise, you won't. The purpose of this referral authorizations is to be able to come in and add the effective date. We're just going to do May 1st to May 30th. Okay, our primary physician is going to be Dr. Jones. Our authorized physician is my staff doctor. And we're going to choose Dr. Smith is who I'm seeing. This is my referring, whatever the authorization number is. And then down at the bottom, you have the choice to right-click, and you can add a CPT range, a CPT code, or diagnosis code. So if I'm coming in for just an office visit, that's what my authorization is for. You don't know which CPT code is going to be used, so we can choose a range that's been set up ahead of time. Or you can come in and add a new range. So if we just do, we'll just call this an office visit, and we're going to go 92002 through 99214. So that'll pull all of my office visit codes. And we'll say I have one visit allowed. Okay, that's going to show that for the month of May, when I see Dr. Smith and Dr. Jones is listed as the referring doctor, the system is going to prompt this authorization number to pull onto that charge for me, and then it's going to deduct my visits. So evidently I already have a office visit in the system during this date range, because you can see it says 0 remaining. The system will keep track of how many visits have been used. Okay. Whether or not you use this, it's up to you. You can edit. You can go in and delete this information. You can also manually type in the authorization number if you didn't want to set it up at this screen. Okay. Then the eligibility tab. The eligibility tab is a service offered by both clearinghouses, Gateway and Relay Health. For eligibility, right now Relay Health is integrated, so you can right-click and verify eligibility for this particular insurance, which is Blue Cross, directly from the patient's account. Once you do that, we choose our doctor, and it's going to go out and it's going to try and connect. Now, right now, we don't have anything set up for it to connect, so it's not going to do anything. But once it is set up in your system, you can then come in and view the report. There's a delete and a refresh option. Okay. If we view this report, it couldn't connect to anything to get any information for us. All right. Now, when that happens, when you do run eligibility, it changes over on the right side under the verified column. It changes this to a green circle or a green check mark, indicating this insurance eligibility has been verified in the last 48 hours. All of the red X's mean that insurance has not been verified. Okay, so that's what that icon is for. And then again, I mentioned our copay. Yes, a referral is required, just so your staff can see from this main screen what's going on. Now, if I wanted to promote this, I can right-click, and of course I can edit and go back into the insurance. We can right-click, and I have a delete option. Now, this is the one we just added. I don't want to delete that, but maybe I no longer have United Healthcare. So I can expire this one of two ways. I can right-click and delete it, and it's going to move it down here and redline it. Or I could have just put an end date right here. So this was inactive on April 30th. That would also mark it as deleted. Now, if I wanted to undelete, there is an undelete option, and that reactivates that insurance. Remember, all of this is being audited and kept in that history. Okay? Now, the next two options are demote and promote. Blue Cross is now my primary, so I can right-click on it and just promote it until it's in the primary position, then Medicaid, and then Vision Care. Okay? You can right-click on an insurance and verify eligibility from here. And then this hide inactive insurances, when this is checked, okay, so there's a little check mark next to it, it hides all of those redlined insurance plans, which if you're in billing, you don't want to do that, because you come in here and you don't see any deleted coverages. You assume, well, there's no other history on here, where if those are visible, you know that they did have previous insurances in the past. Okay? So just be aware of that hide inactive and what it does. Then we have, of course, just the refresh option. Now, over on the right side, our guarantor, this is who's going to get the statement for that. If I want to make my statements go to Richard, I can choose his name as the guarantor. And then the second little button over here is open the guarantor's information. I can click on that, and here is Richard Smith's account. Okay? So it's just a quick way to go back and forth between the patient and the guarantor. Okay, so that's pretty much it for the insurance. We're going to go into the notes section. The note tab is a place for generic notes. They're not specific to a charge. They're not specific to an appointment. It's just general information that needs to be documented so people can go back and reference it. With the notes, I see a lot of times the registration paperwork that the patient fills out is either documented in here or scanned as an attachment, which we'll look at in just a minute. These notes have been added really just for, again, general information. So to add a note, we right-click and add, and we can go in and we can put the subject line, and we'll just call this past due account, collect payment. All right. So I can go in and choose a color just to get people's attention if that's something I wanted to do. And I can mark this as an alert so that it will pop up as soon as that account is opened, anytime that account is opened. Now, the type of note, public and private. With the public note, that means that the subject right here, past due account, is going to be visible to anyone who opens this and comes into the notes. Private means it's going to show up like this. On the left side of the screen, there's a line that just says private. That's how it will show on that patient's account. So perhaps that is a more sensitive note. You don't want it just to be open. You want someone to have to actually click on it to read it. Okay? Now, with private in the alert box, the alert will override the private setting. So let me show you what I mean. I'm going to keep this as private, so click OK. And now here's my note. It says private. In order for me to see that, I have to come down to the bottom left corner and click Show Private Subjects, and then it will show me that subject in yellow. Okay? Now, if I close this account, go back into it, here's my alert. So even though it's marked as private over here, because I said this is an alert, it is going to show that full description of the subject. So just be aware of that. Alert and private do not work together. The alert will always override it. Okay. Then we have display this note until. So if you always want this note on here, you don't know, how long you want to have this note seen, you can leave this box blank. But if it is something specific to a time frame, you can tell this to only stay on this account until the end of June, at which point it will fall off this patient's account, kind of delete itself. Okay. You can also print this on a statement until a certain date if that's something that you wanted to do, and then you have additional notes down here in the bottom. Okay. If you wanted to, you can go in and edit or delete a note. Okay, we just right-click and delete those. You can edit, view who made that note and when they made the note. Okay. Any alerts that are set up will stay as an alert until this box is unchecked. All right, so just be aware of that. So that's pretty much it for notes. Again, they're just general notes for you to enter on that patient's account. The next tab is attachments. This is where all of the patient attachments are saved. Whether you scan a document, so registration forms, that type of thing, or you print a word merge letter, you go in, merge the letter. Okay, so if we were to do this past due, let's go back a year. It's going to run that word merge document, and then we can go in and, make whatever changes we want to make, print it, save it, and now it's going to automatically save as an attachment in this patient attachment tab. Okay, you can right-click and view it. You can also right-click and attach a new letter. It's just going to ask you what you want to save. Okay, you can link or import. You have a scan option. The scan is the same window if you were to come up and click on the flatbed scanner. Okay, the scan icon is the very first one. Okay. The system automatically saves a copy of the statement and claim forms, whether it's a HCFA or a UV, in this patient's account. So you can always go back and reference when they got a statement, what their claim looked like, when it printed, really anything like that that you wanted to go back and view. Okay, there's a right click. You can send this via email. You can delete it. You can export this to your desktop if you needed to save it somewhere else. And then there's a refresh option down at the bottom. Okay, so again, you can use the scanner, or you can right-click in this tab and scan those documents. All right, so relationships. Under relationships, this is a place for you to go in and say, this patient, Jennifer, is related to this patient in this way. So this shows that Damien is my child. Okay, I can right-click and add. First thing is choosing your relationship. So maybe, we're going to go in and say that Harold is my father. Really just a reference for your office so you know, you can go out and find who is their parent, who's their brother, sister, whatever you want to do. Those have to be set up in order for them to be in here. It's not an automatic link. Okay. Then, of course, you can right-click and edit. You can right-click and delete. Maybe this was incorrect. I'm in the wrong patient. You can also right-click and open that patient's account. And now we're looking at Damien. Okay? So that is the relationship. Under EHR, this is where all of your EHR visits are going to be stored. You can open a new and an existing, view the narratives, the attachments, the thumbnails, lab results. You can import and export visits, and then there's a select all and refresh. If you have EHR, you're probably pretty familiar with this because you'd be using it on a regular basis, but your EHR specialist would be able to go through and answer any questions you did have about those. Okay, but that's where all of them are available. Let me actually pull up his account so you can see a few visits in here. So when we're looking at Carl Aaron's account up here, the first column, these are finalized records. The second column, if there's an icon, that means that record is locked. And then the third column has this little blue globe-looking thing. That means that visit has been published out to the patient portal. So the patient can log into their portal and view the full narrative for that particular visit. Okay. Date of service, when it was created, the type, what their diagnosis were, and then if we scroll over, who finalized it, when it was finalized, who locked it, if it's locked, and then who the physician is. Okay. You can move these columns around. If you accidentally click on it, just move it until you see the green arrows line up. If we wanted the physician name over here, we can move that over into this position. Okay. All right, for prescriptions, and we're just going to stay in Carl's account now because he has a few different things in here. For prescription, we have the date your physician prescribed that medication. It does not show any outside prescriptions that were made. The medication that was for, the quantity, it was 1 bottle, the instructions, how many refills they have, and the physician. Now, if you right-click, you can prescribe, which is going to take you out to the Dr. First website or Relay Health, depending on which one you're using. It's the same as clicking on this RX button up at the top. Okay. You can also right-click and add. So if there's a medication that maybe the prescription was done on paper, prescribed this yesterday, I was Dr. Jones, what the medication was, the quantity, the units. We can go fill all of this out and save that information. Okay. The number of refills, the start and stop date, special instructions, and then down here is where we have the check boxes that give you guys credit for meaningful use. So computer authorized entry. This particular one was not because we hand wrote it. It was prescribed, controlled substance, formulary checked, administered, and transmitted. So you have the option to manually add this information if you wanted it to show in their prescription tab, okay, without e-prescribing. There is an edit and delete option. Once they're prescribed, you probably don't need to edit it too much. You can see Relay Health prescribed through Relay Health eScript. Formulary checked, it was transmitted, it's prescribed. So these are, again, all of your little checkboxes are giving you guys the credit for meaningful use. Okay? That's prescription. Then we have the physician tab. Under the physician, the left side of this window shows us who the referring is and who the primary care is. The right side of this window is based on the patient's charges. So I can see what doctor they typically see. This patient, by date of service, has always kind of gone back and forth between Dr. Hodges, Dr. Jones, and then a couple times he saw Dr. Smith, okay, over the years. You cannot right-click and edit or delete anything. It's just informational. So you can quickly see who was the last doctor they saw and when was that date, okay? Over with the referring, if you wanted to change this, we can say that this referring doctor was actually Dr. Odie, and their primary care is also Dr. Odie now. Okay, so you can change that information. You can right-click and add a new physician. Is it a referring, a primary care, co-managing? I've seen quite a range of physician types or relationships in this drop-down. So whatever works best for your office is what you'll want to use. Okay, you can also right-click and delete if that's no longer appropriate. Okay, all right. Under statements, by default, every account in the system until it is changed, patients are set up to get a monthly statement. That is what you want it to. That's what you want to happen. Is all patients to get a statement every month. If the doctor says, don't ever bill this patient, you can come in and suppress those statements, and the patient's claim will still go to the insurance, but then they will not get a statement printed out. The two options in the middle, only after action from primary, only after action from all. When you check these, patient will not ever get a statement until every single claim out here in the financial form has received action from either the primary insurance or from all insurances. So if you have an old claim that's kind of giving you a hard time and you're still appealing it, trying to get it paid, patient will not get a statement until every single line item has received action. All right? So typically you do not want to use these two fields because it's not just one claim. Monthly is the best option if you're going to send statements out. With the designation, you can go in and say this patient is in collections, they're in pre-collection, and then the date it was changed. This is one way to just run reports and find specific patients. I've seen offices use this as a hardship, and that way they can keep track of those patients who are having that hardship and avoid sending a statement out to them. Okay, so that's optional. You certainly do not have to use it. And if you want to declare it, you can just highlight and hit delete. Okay. Now the custom fields. Custom fields are fields that you have complete control of. If there's something you want to keep track of, for example, how did you hear about our office? And there's not another place in the system to keep track of that. You can create custom fields and report on those. So right now, we have how did you hear about our office? We've created that as a custom field under File, Administration, System Properties, and then the patient demographics. Then we can go in and create our table for how you heard about our office. Maybe it was the Yellow Pages or the Internet or a friend. It was a referring physician. Okay, and then you can report on those and find how many patients were heard about your office from the radio ad or from a referring doctor versus the Internet. Okay, so let me just show you real quick where those are set up. So if we flip over File, Administration, System Properties, and then under Patient Demographics, you have up to 5 of those custom fields. Okay, so if I wanted to say You know, you want to keep track of their hairstyle or their eye color, or their, you know, you want to keep track of your patient's environmental allergies or injuries, or really anything that you can think of, you can put in here, okay? So that is a choice that you have. Come back over to our patient. All right, so that's custom fields. Those are separate from the custom fields in scheduling. You have 5 in each location, 5 for patient demographics and 5 for scheduling. Okay. All right, the other IDs, if the patient, you know, this patient, Carl, brought in a military ID, and this is the ID number, we can document that. We had to add this field for meaningful use for us to be a certified product. If that's something that you don't use, that's okay. It's available if you need it, okay? Right-click, add the type of ID. If somebody brings you in their passport, what is the number of that passport, okay? The alias. This patient also sometimes goes by Mr. Glaucoma Johnny, okay? So if he called you and gave you Glaucoma Johnny as his name, then you can go out and search for Glaucoma Johnny instead of Carl Aaron. So our account number is 28425. We're going to go out and we're going to search for this patient by this name instead of his real legal name. All right? We're going to go into our patient search, and we are going to search for Johnny, and we're going to search for glaucoma. Here's our patient, 28425. We go into that account, and here's our alerts. Okay, well, is this Carl Aaron? Yes, everything's, you know, confirmed, verified. Just a way for you to find those patients that have, you know, a maiden name. Maybe they're divorced or they just like to go by Johnny Glaucoma. Okay, so that's up to you. With the directives, you can right-click and add the different directive types. This list is what has to be in here. We cannot change this. We have the living will, power of attorney, a DNR. Are they a tissue donor, pregnancy? So if there's a power of attorney, put our notes in here, all the information that you need, click OK, and then you can scan that as an attachment, show it so you have it on file as well. Okay? If this is no longer valid, you can right-click and delete that. And then the other tab, you really don't need to worry too much about this. This is also for meaningful use. We have our patient class. This is outpatient. We only have one office that uses a different classification, so you don't even need to change that. It's set up for you already. The publicity code, this is for appointment reminders. I want to make sure that you guys are sending out reminders for your patients. We also have this last reminder state up here. So you really don't need to choose anything in here. You are doing appointment reminders. So this is if the patient says, you know, don't call me, only send a reminder, you can come document that. And then the protection date is for immunizations, their last immunizations, or the date you administered immunizations. If you're not giving anybody those shots, then don't worry about it. We just have to have it available for any client who was to immunize their patients. Okay? So that's all of the tabs across the bottom. Real quick, we're going to mention these menus up at the top. I know we're running a little bit late. Under patient, there's switch patient. That's the same patient search screen that you would find if you clicked on the search icon. Okay, that's just to go from one account to the next. When you merge a patient, it's going to ask you, are you sure you want to merge this? Go ahead and click yes. Find the patient you're going to merge it with. It tells you if you continue, Carl Aaron is going to disappear and everything is going to be under Harold's account. Are you sure you want to do this? Once you click yes, there's no going back. We cannot unmerge patients. You would have to manually go through and separate those charges and EHR visits and everything and recreate Carl's account. Okay, so we're going to say no. We don't really want to merge. Just make sure that most people in your office don't have merge rights, because we cannot undo it at all. Okay. The copy patient information from, we're going to go through these steps, even though we're not actually going to save it. But when you click copy information from, it asks you, are you sure you want to copy information from another patient to this patient? This is a great tool when you have, a mom or dad or a family, a couple of kids, they all live at the same address, they all have the same insurance, and you're tired of just typing that information over and over. You can create the first account, save it, go into create the second one. So this is going to be pretend Carl is our child. We're going to say, I want to copy information from, Jennifer's account in update Carl's information. So it shows you all of the check mark boxes have data in that field. You can see the last name, the address, address to, the guarantor, zip code, city, the state, okay, the date they signed their HIPAA forms. That's going to be unique to each patient, possibly. We want to copy the class, the preferred contact type, the user password. Maybe we don't want that to be the same, so we can uncheck it. And the insurance, the phone, and the email. So you can uncheck any boxes that you want. If they have data in them, once we click OK, it's going to update Carl's account with Jennifer's information. Okay, so if I click OK, his last name is going to change to Carmen instead of Aaron. It's a very quick way to copy all of this information, like I said, from multiple accounts when the information is truly the same. Okay? Once you click OK, it's going to go and update all of these fields in Carl's account. You're going to see his last name change in just a minute because I left it checked. And he's going to now be Carl Carmen. Okay? As soon as it's done thinking. It does take it a second because there's so much information to copy. It pulls across all of the insurance information. It pulls across patient IDs. I'm sorry, not the patient IDs, the insured ID numbers, images of the insurance cards if they are scanned into the system. It will pull all of that information over for you. And let's see if we can close this. Okay, let's try this again. All right, so let's go back into Carl Aaron, and you can see it did actually update. It just kind of froze up for a second. Here's the last name. Here's his new address. His insurance information now matches. So it does pull everything over for you. Okay. All right, there's a refresh option. It just refreshes the patient's account. Okay. Then we have the add security item and delete security item. Now when you add a security item, it locks that patient's account and only my username and SysDBA can get into it. So this is now the security item name. Patient ID 28425 is the security item. So what that means is if any other user would try to pull up his account, they're going to get a message that says your permissions do not allow you to execute this function, and it's going to say patient ID 28425. The system administrator under the SysDBA login would have to come in and delete that security item for it to be unlocked and available to everyone again. Okay, that's what those are for. The interface, this is where you can manually force a patient across for e-prescribing. The label generator, we can go in and print an address label, print just a chart label if that's something we wanted to do. We'd set your settings to match what was appropriate. This prints best on the little Dymo label printers. You can tell it to choose the first address or the second address, format. So that's something that you can play with if you wanted to start printing labels. Okay. Printing a statement, when you click print statement, it's going to ask you what criteria you want. This is a mini version of our actual statement processing screen. So you can say print zero balances, print credit balances, don't wait for insurance, I want aging, you know, only balances greater than $2, and then our due date. Okay, once you click OK, it does actually print a statement. It does not let you preview it. All right, and then that statement will update in the patient's attachments, but it will not count as the monthly statement for the patient. So if the patient's here today, they want a statement before they leave, you print it out, they're fine. Next Monday, when your office runs statements for everyone, this patient will still get a statement if they meet the criteria because they have not received a monthly statement. These individuals do not count toward that. Okay, so just be aware. The patient information sheet, that's the same as clicking on the little people icon, which used to be the red folder. It's just a way for you to go in and print all of the demographics, history, financials, insurances, have them verify everything is still correct. Okay, this one we can preview. So here's our patient information sheet, sign it. Just another way to get into it. All right, of course, clicking on this icon is the quicker way. The next one is the patient word merge. With the word merge, it's the same thing as clicking on this word icon up at the top. It takes you into your form letters. You can highlight the letter that you want and click merge, and that letter will print as well as save in attachments for you. Okay. The next option is the patient's date of death. When you put in a date of death, it will not, if you have a date that's in the future, it grays it out, so you cannot click OK. It has to be a current date or in the past. Once you click OK, it is going to ask you, what do you want me to do with all of the appointments that are still out here? We can go in and say office canceled, okay, and it will cancel all of those patient appointments. It also stars out the age, and up at the very top you can see we have patient deceased. All right. Now if I were to go back in and take that date out, click OK, then our age is back. He's 92. Patient no longer has the deceased flag at the top. However, it does not reschedule all of those appointments that you just canceled. So just be aware that you will have to go back in and re-enter all of his future appointments that he had. Okay, you can see they've all been canceled at this point. All right. Patient in reports, we do want to include this patient. The properties shows you when the patient was created, who the last person to modify it was. All right. And then, of course, there's a close. The billing menu takes you into the financial form, the payment screen, or printing a super bill. It's the same as clicking on the financial form here or the payment option here. Okay. Scheduling, you can click on appointments, which is the same as clicking on this calendar. You can print a super bill. You can also access the waiting list, which we'll go through in another webinar. Optical entry form is the same as clicking on the E with the glasses if you have the optical module. And then execute is where you can add external programs to pull up from this patient account, such as Word or Notepad or Excel. Okay, it's just a shortcut link, and that's something our support team can help you with if that's what you wanted to have as an option. Okay, so that pretty much does it for the patient demographics. If you have questions, please let our support team know. Otherwise, I appreciate your time today, and hopefully this was helpful. I hope you all have a great weekend, and we'll talk to you soon. Thanks. Bye.